All right, it is No Shave November and Movember, when people are encouraged to grow mustaches in order to raise or grow awareness for men's health issues, including prostate cancer.
And prostate, the second most common cancer among men, with more than 260,000 new cases reported just last year and about 34,000 deaths last year alone. Joining us now to talk more about prostate cancer, Dr. Robert Princenthal. Doctor, welcome.
Thank you very much, and I'm glad to be able to talk about Men's Health Month.
Yeah, when we talk about prostate cancer, what are the signs? How do you diagnose it?
Well, first of all, prostate cancer and breast cancer are really two sides of the same coin. Roughly 250,000 men and women are diagnosed each year, and roughly 30,000 men and women unfortunately pass away. Women have done a great job fighting for their health and being advocates for breast conservation and getting mammograms. Men need to be less afraid of the disease and get screened. So we recommend that men get screened starting at age 50 with a PSA. If the PSA is elevated, please get imaged. We can do a mammogram with prostate MR and clearly identify tumor if it's present, so that if they're recommending a biopsy, it's because there's something of concern.
And again, men should go for screening, you said, starting at age 50.
Correct. And the whole benefit of combining PSA with prostate imaging with MR is that we can really reduce the harms of unnecessary biopsies. And just the way women advocated for breast conservation and minimal intervention, instead of having just two options of removing the prostate or doing active surveillance, now we have the ability of offering focal therapy for men who meet inclusion criteria. So instead of having to remove the prostate, we can use high-intensity focused ultrasound to kill the cancer as a safe outpatient procedure and maintain men's functions after they recover. And the recovery is very simple and very easy.
Doctor, it sounds like if it's caught early, the treatment is pretty bearable. Tell us about this new FDA treatment we've heard about, TULSA.
Well, TULSA Pro is a device made by Profound Medical, and it's a revolutionary product that I think is a game changer. It uses real-time MR heat mapping to heat the tissue to 55 degrees centigrade so we can kill the tissue and we can safely spare the nerves and the vital structures around the prostate. So we have high confidence that we can kill the tumor, outpatient, high degree of safety, very few harms or risks. The patients go home the same day, only on Tylenol. There's no pain. And the outcomes are showing similar oncological control to surgery and radiation. So for men who are diagnosed with prostate cancer, they shouldn't be so afraid that their only option is surgery. They should talk to their urologist and find out if they're a candidate for this new technique and what the different treatment strategies might be for them.
All right, Dr. Princenthal, thanks for joining us, and certainly some good, valuable information there.
I got my mustache going.
We see it. Thank you,
I think you got an early start on that one.
I don't think that's 3 days
so
in,
much.
right? Thank you, Doctor.